I also expect today that there is bound to be some unease for some people around vaccines, now that Canada has reported a first blood clot event connected to the AstraZeneca vaccine. A Quebec woman is reported to be recovering at home, having experienced a blood clot within 2 weeks of receiving the AstraZeneca vaccine. It is the first event of its kind in Canada, where we have administered about 700,000 AstraZeneca doses. By any scientific definition, this is a very rare risk. But for most people, it's information overload out there, and often information that's more alarming than reassuring. So I want to reassure you. News about the vaccines emerges frequently. There's a lot of information available on the internet, and some very unqualified vaccine skeptics sowing fear and misinformation through social media. Let me put into context the odds and risks of developing blood clots associated with vaccine and try to put that 1 in a million figure in some perspective. I found a table of risks in a publication for physicians that helps to illustrate the point, and I chose one practical example of health risk and 2 that probably seem to most of us as pretty unlikely to happen. So, the chance of any of us dying in any accident at home in the next year is 1 in 7,100. The chance of being hit in your home by a crashing airplane is 1 in 250,000. The chance of drowning in the bath in the next year is calculated at 1 in 685,000. And as I said before, the current estimated risk from blood clots associated with the Johnson & Johnson vaccine is 1 in 1 million. Most importantly, though, the events of the last 24 hours show us that all the systems are working to assure safety in vaccines and to thoroughly investigate and understand any adverse events.